Acute heart stroke is a real cardiac emergency in which all the treatments are time sensitive. In 90% of the patients where blood pressure is good and heart pumping is good, we can just do an angiogram and open the blood vessels. These patients will get stabilized. But in 10% of the patients where blood pressure is low and heart pumping is severely depressed, these patients are quite unstable to do any kind of angiogram or angioplasty. But with the emergence of level 1 cardiac emergency care, so we can change outcomes in these patients.
To treat these critically ill patients, we have a structured policy and protocol at our Medicover Hospital. We have a team of doctors who can rapidly triage, assess, resuscitate and stabilize the patients in the departments within minutes. And we know in ACS, time is muscle. We involve the ACS team or MCS team depending on the criticality of the patients and involve them early and stabilize the patient early, and will shift the patient to the cath lab to save the heart muscle at the earliest.
In our level 1 cardiac emergency care, our team of experts including interventional cardiologist, mechanical circulatory team and post-care team comes together within no time to take care of things for these kind of patients. We put Impella or VA ECMO, which are available on site in the hospital within no time to the patient, and then we complete coronary angiogram and subsequent opening of blood vessels.
Once the patient is shifted out of the cath lab and comes into the ICU, he needs intensive monitoring, and we have 24 hours critical care coverage where the patient is monitored for his heart rate, blood pressure and continuous ECG monitoring. Any changes in the ECG can be taken care of immediately and can be corrected with medicines or defibrillation. The hemodynamic monitoring, that is blood pressure monitoring, can be done continuously or intermittently and can be taken care of immediately when required. The patient, if requires any ventilator support or the renal replacement support, can be provided in the ICU itself.
The best cardiac results come when you handle the patients in the golden hour. In high-tech city Madhapur, we have 25 cardiologists, experienced hands working round the clock to give the best cardiac output in this part of the country. So you have a cardiologist who can do a primary angioplasty anytime during the day and night, 24/7, 365 days a year. So that our door to balloon time, which determines the success rate or the results, is less than 40 minutes from the time the patient consents for primary angioplasty. It gives immense pleasure and satisfaction that we are doing the utmost complex procedures with very low risk. The most complex angioplasties, multi-vessel stentings, where many patients were being rejected in many of the centers, were taken care in this facility. We stand tall shoulder to all the people are delivering the best of the cardiac outcomes.